Hi, everyone. Today I'm going to be doing a review of the Practitioner's Guide to Ethical Decision Making by Forrester Miller and Davis. A proper ethical decision-making model is imperative due to the multiple decisions you will have to make as a counselor. Some of these decisions will be smaller, for example, what type of information should be shared with a parent of a minor client, and some will be larger, such as proceeding with a higher level of care for a client. So Beecham and Childress, along with Kitchener, identified a total of 5 foundational principles of best ethical practices in the helping professions. These principles are necessary for a healthy counseling relationship and are at the cornerstone of ethical guidelines for counselors. So these include autonomy, which is allowing and encouraging the client to make independent choices and decisions, helping them understand outcomes of these decisions, and ensuring that the client can make rational and competent decisions for themselves. Justice is giving proper care to all and adjusting to their particular needs. Beneficence is doing good, being proactive, and preventing harm. Non-maleficence is ensuring no harm and weighing potential harm against potential benefits. And fidelity is honoring commitments and doing what you say you will do. So the counselor can evaluate the situation through these principles to see if a decision can be made. If a decision still cannot yet be made, the ethical decision-making model should be utilized. The steps are listed here, but I'm going to go into more depth of each one. So first is identifying the problem. Writing out all the facts can be helpful, and you can ask yourself if it can be ethical, legal, professional, or clinical problems. Legal advice may be necessary, so it's important to look at all angles to avoid simplifying the dilemma. The second step is to apply the ACA Code of Ethics and to consider any multicultural perspectives. Keep a copy of these ethics to always refer to when needing clarification on something or deciding a course of action. If there's still a decision to be made, step 3, we'll move to that, is to determine the nature and dimensions of the dilemma. So look again at the foundational principles to see which one takes priority in this situation. Review the professional literature to consider diversity issues and that decisions are based on the most current professional research and resources. Consult with colleagues and supervisors to review all this information to gain potential other perspectives. And consult with state or national professional associations for additional help with the dilemma. So step 4 is to then generate potential courses of action. This is when you consult with colleagues and creatively brainstorm. Step 5 is to consider the potential consequences of all options for the client, others involved, and how this will affect you as the counselor. And of course, get rid of any options that could have problematic consequences. Step 6 is to evaluate the selected course of action. Apply 3 tests to ensure appropriateness. The test of justice is to assess a sense of fairness to determine if you would treat others the same in the situation. Publicity, would you be okay with this course of action reported to the press? And universality, would you recommend the same course of action to another counselor in the same situation? If your decision does not pass these tests, it will be necessary to go back and reevaluate using the same steps. Once these tests are passed, then you can move to step 7, which is implement the course of action. Then follow up on the situation to assess whether the actions had the anticipated effect and consequences. You should be able to professionally explain your rationale for the decisions that you made. Fully document this entire process in the client's chart. So you will know when you're acting in a professional and ethical manner when you have maintained personal and professional honesty, when the best interests of the client are held in high regard, when decisions are not made in malice or for personal gain, and when actions can be justified based on the best judgment of what should be done based on the current state of the counseling profession. Making decisions may not be easy at times, but having an ethical decision-making model can help achieve the best outcome for the client. Then here's the reference for the article that I used, and I thank you so much for your time.